And I want to turn it over to our Lieutenant Governor so she can say a few words as well. Sabina?
Good morning. Hopefully I won't mess this up. Good morning. I'm very joyful to be here today to celebrate this important milestone of over 100 million shots in arm. This is so important, and I can tell you, I was just talking yesterday with someone, and I was asking them to, let's just stop for a moment and think about where we were last year, this time. I can tell you in my case last year, at this time, my dad has just come out of the hospital from being there for over a month, almost over a month, and being intubated for 9 days. And the range of emotions that we went through in my family with him being ill. Like my family, so many other families went through that same of emotions. But there are many families that didn't have the fortunate that we had to have my dad back with us. And also because I have a large family, I can give you other examples. 2 of my father's brother died of COVID in Massachusetts after my dad came out of the hospital. So this has been so hard in our community. It's so hard, like the experience that we have been living, all of us as a community together. To be here today to mark this momentum is just amazing. Just think about it. Last year, we didn't even think that we were going to have a vaccine. We have to stop and celebrate the big difference that today makes from where we were last year. I also wanted to say that I feel so honored to be here to introduce next Dr. Nicole Alexander Scott. I was so happy to see her every day together with former Governor Raimondo, giving the updates. So calm, so poised, and so smart. I just want you to know that you have left a lasting image for me and so many other women and women of color. So thank you so much. Thank you. Finally, before I move and I pass the mic over to Dr. Nicole Alexander Scott, I just want to, for all of us to take a moment, take a look at everyone in here. Look at the diversity that we have here. This is the best team when everyone has an opportunity to contribute to find solutions. So I want to thank the governor for his leadership in maintaining this strong team together. With that, I'm just so thrilled to pass the mic over to Dr. Nicole Alexander Scott.
Thank you, Lieutenant Governor Matos. Such an honor to follow you. Thank you for sharing your family's story and your father's story of strength. And I also get to honor you and say how proud we are of what you're doing as well. I also want to say thank you to the governor and to the entire team here. What better an opportunity while here to also acknowledge all of the nurses during National Nurses Week. It's a great time to get to 1 million doses in Rhode Island when we're able to honor those who have been on the front lines since the very beginning. My mother is a retired nurse, retired as director of nursing, so you all have a very special place in my heart. 1 million doses administered. That is an incredible feat. Dr. Levy, Dr. Holland, and all of the healthcare providers throughout the state, thank you. Thank you for your presence, your commitment, your compassion, and resilience through a very challenging time on behalf of all healthcare providers. This has been a year like no other, and everyone is doing heroic work. The healthcare providers deserve a thank you, and so do the healthcare organizations throughout the state, and so many more individuals who have extended an extra hand and helped to ensure that neighbors and family members are taken care of. All of the hospitals, including Rhode Island hospitals, all of our pharmacies, have been tremendous partners, and our community health centers, wow, they have stepped up in a huge way to help make sure that we have coverage in every zip code in the state. All of our primary care providers, nurses, staff, those who are on the front lines. There have been dozens and dozens, if not hundreds, of individuals who have helped make this happen today. And we have to really acknowledge our community leaders, our community organizations, leaders such as Pastor Jenkins, who have done so much work on the front lines, meeting people where they are. That's what's going to be necessary to get us across that finish line. Another unsung hero of the last 5 months is Rhode Island's Medical Reserve Corps, which also goes by DMAT. This is a group of volunteers who are ready to drop everything and help the state respond to a medical emergency when they get the call. And of course, I have to acknowledge the tremendous amount of work put in by the staff at the Rhode Island Department of Health, people all throughout state government. We have Department of Education, we have Commerce, and the one and only General Callahan and the team at the Rhode Island National Guard. So as exciting as this 1 million number is, we also want to use this moment to express that we cannot let up now. I love the sports analogy that the governor shared. This is the time really to put on the full court press. We're just getting into the last leg of this race, and we have to keep pushing. The reality is that over the last year, COVID-19 has changed. It has evolved. The original virus has been replaced with newer versions that we are referring to as variants. If you get COVID-19 right now, there are chances that you may have a more serious disease than you would have earlier in the pandemic, regardless of your age. If you have not been vaccinated yet, that means you are even more susceptible to that. So please, protect yourself. Protect the people you love. Protect your entire community by getting vaccinated. Don't just wait for herd immunity. That's not going to protect you as the individual. You need to get vaccinated as quickly as you can, because with the virus and the new variants that are out there, looking for whoever's out there that is not protected. And if you know someone who has not been vaccinated, inform them, encourage them, speak to them, help them get to a site to get their shot. We have tons of places throughout the state where you can go to get vaccinated. We have a system that has been built and set up to make it accessible for you. I want to speak directly to parents of children ages 12 to 15 years old. Right now, you are the group that can start thinking about helping a loved one get their shot. We are so excited that we can expand to this younger age. There was some great news yesterday about that from the FDA, who carefully reviewed all the data from clinical trials on children from 12 to 15, and who has determined that the Pfizer COVID-19 vaccine is safe and effective for children. Let's do in Rhode Island what we do well. Let's vaccinate and protect our children. With thanks and support from our amazing subcommittee for COVID-19 vaccine, who we spoke to just this morning, as of today, we are moving forward with vaccinating children 12 to 15 years of age. Over the coming days, we're going to be working with all of our partners to allow administration to start at all of our current vaccination channels for those 12 to 15 years of age. That also includes schools, where we envision children 12 to 15 years of age getting vaccinated most easily with parental consent. The cities and towns and school districts throughout the state have done a fantastic job getting clinics up and running for their older students. So we're very excited to build on that and expand this partnership in collaboration with our Department of Education. This is huge. 1 million doses, and we're able to expand to our younger population. Because children could not get vaccinated, and because we are seeing those more contagious variants of COVID-19, we have seen an increase in our proportion of cases in children. So the timing right now is perfect. To all the parents and families out there, there is a way to help keep your child healthy and safe. Let's do what we can to protect our loved ones. It's also a way to keep your child out with friends in summer camp, enjoying our beautiful Rhode Island and doing the things that kids love to do without having to worry about concerns of COVID-19 spreading or having to quarantine to the same extent if exposed. Rhode Island has been doing great in the vaccination campaign. From what we focused on with phase 1 to how aggressive and effective we are with phase 2 to our focus on meeting people where they are with phase 3. 1 million doses is exciting. It is something to be proud of, something that we say thank you to all those who have served to help us get there. As we open up to this next population, let's keep up the great work and get as many eligible Rhode Islanders vaccinated as possible, from the very oldest to the youngest at 12 and beyond. Thank you to everyone, and with that, I will pass it to Tom McCarthy.
Hey, good morning, everyone. So I'll be brief and just say thank you. I want to thank everyone that's worked so hard every day over the last 5 months to make Rhode Island a national leader in COVID-19 vaccines. I could not be more proud to be a part of this team of dedicated, selfless public servants. I also want to thank everyone that has done their part and gotten vaccinated and helped someone to get vaccinated. These 1 million doses administered is an important milestone, but what matters even more is the impact, the cases that have been prevented, the hospitalizations that have been avoided, and the lives that have been saved. So with that framing in mind, there's still a tremendous amount of work to do. There are hundreds of thousands of Rhode Islanders that have still not yet been vaccinated. So with that, we're going to continue to push every single day to make sure that every Rhode Islander has every opportunity to get vaccinated. So while we celebrate this important milestone, we're going to continue to remain focused on ensuring that we sprint across the finish line. So again, thank you to everyone. Let's keep it up, and with that, turn it over to General Callahan.
Thanks, Tom, and good morning to everyone up front here. Sir, thanks, Governor and Lieutenant Governor. Thanks for the opportunity to just share a few words from the National Guard's perspective relative to the fight here in COVID-19. I would tell you that we would like to also spend a moment to recognize our healthcare providers, and my number one, Dr. Nicole, my battle buddy, and just to let you know that our healthcare providers over the course of the last year have set a standard for support that we have tried to emulate. I think we got close, and we work hard to try to do that every day, but we are very fortunate as an organization to get a lot of support within the interagency, and it was good to be in a position to provide support to our healthcare providers and continue to do that and sort of be on the backside of that work. I do want to extend recognition and appreciation to all of the employers and families of the Rhode Island National Guard. Most of our service members, as many of you know, have full-time civilian careers in addition to the work they do with the National Guard. Since March of 2020, over 1,000 Rhode Island National Guard soldiers and airmen have been activated full-time with us and stepping away from their careers and their professions. They have assisted and supported the state response by conducting just over 300,000 tests, assembling and distributing over 1.5 million testing swab kits, and we're close to about 290,000 of the doses administered have been done by the team. So we're very, very proud of that. But again, I would share with you that without some really tremendous support by the employers that have had to go without what I would consider some talented people for the last year. They've been gracious and have been very supportive, and I just wanted to share that. Right now, we've got about 500 guardsmen on duty right now from a high of 1,000 about 8 months ago. And they are working vaccination sites, 5 different pods right now, doing some site security, assisting with RIDO and the call centers, the Education Operations Center, and things like that. So it's been a truly incredible opportunity for the team within the interagency, and we have continued to learn quite a bit, and we're very, very thankful for the opportunity there. So I would not do my job completely if the team knew we were coming out today, and they wanted me to remind everyone that if you're in a high-density community, there are 23 different community sites, from community health centers to pharmacies, that will be available this week. So they'll be out, you'll see them, and they want to continue to get the job done. So we're really proud of being with and behind the team. And with that, I'd like to introduce Dr. Levy. Please, sir.
So it's a pleasure and an honor to be here, and actually a relief to be here to celebrate the millionth dose of vaccine given in the state of Rhode Island. It was in this room in mid-December when I received one of the first, as you heard, doses of vaccines in the state. And when I think back on these 14 months, so for so long, we were really struggling in the dark with this terrible illness. We had no proven therapeutics, and really except for good supportive care. And then finally, after a number of failed trials, we had one positive trial with dexamethasone, which was a relief, and which demonstrated that a single dose of steroids a day for 10 days conferred a survival benefit. And it's also remarkable that after only 10 months or so a year, we actually have vaccines that are, some of which are 95% effective, which is really remarkable when you think that the flu vaccine, which we also rely on, is only about 55% effective. So it is an accomplishment by scientists to develop a vaccine. And now, most importantly, I would echo what you heard from Director Alexander Scott and others. Please, please get vaccinated. I don't want to see anyone else in my intensive care unit suffering from COVID-19. And with that, I'll say thank you, and I will introduce Pastor Reverend Howard Jenkins from the Bethel AME Church, who's going to speak.
Indeed, good morning. This is a momentous occasion when we reflect upon where we have come regarding this particular pandemic. One of the things that we want to make sure that we recognize, as Governor McKee has identified that we have achieved 68% of the vaccinations. Governor McKee and I have sat down and we have discussed, though the numbers are very impressive, when we look at the disparities within our, whether you're comfortable with black and brown communities or our BIPOC, black indigenous people of color, we indeed recognize, as Governor McKee says, we have a ways to go. We really have to be intentional in a full court press in regards to where we are. But here's the good news story. There has been a team effort for where we have, what we have achieved. And that has been through the leadership of Governor McKee. And it becomes very important that we recognize that we keep our eyes on the ball. It becomes very important that we recognize within our communities, our black and brown communities, our black indigenous people of color, our BIPOC communities, that we are intentional in making sure that we are educating and encouraging our populations to take these vaccinations. We do recognize that there is hesitancy within our communities. We do recognize that there is mistrust within our communities, but we also recognize that we have faith in the science. So I represent faith leaders, I represent community leaders, but I also speak with the voices of those persons that are also still hesitant. We have a lot of work to do. This is indeed an accomplishment, but the real work still needs to be done. I want to overextend how Governor McKee has been instrumental in helping our Black and brown communities and our BIPOC communities. But we have to develop a strategy so that we can cross the finish line and really wave the banner that we have achieved the success within our communities. Governor McKee, I thank you for all that you're doing. I thank you for your leadership. I think this collaborative team, because without the team effort, without RIDO, without the National Guards, without the medical staff, we would not be where we are. And so engaging the community has been an asset, but most importantly, has been an inclusive step. So we celebrate and we recognize the effort, but we also know that we still have to keep our sleeves rolled up and we can't take a deep breath yet. Again, thank you, and may God bless everyone. I'm sorry, I want to introduce Dr. Sabina Holland.
Thank you. Good morning. As a pediatrician specializing in infectious disease, I was thrilled to hear last night that after a very thorough review, the FDA determined that the Pfizer COVID-19 vaccine is safe and effective for children ages 12 to 15. I have seen and continue to see the impact COVID-19 has had on our youth. Children and youth are not immune to COVID-19. Cases in children are rising, and children represent more than 1/5 the number of new cases in our country. I have seen cases of children hospitalized with severe COVID-19 disease and those hospitalized several weeks later because they developed an inflammatory condition called MIS-C after having a very mild case of COVID-19 infection. Our youth are facing another challenge related to COVID-19, and that is the impact the pandemic has had on their mental health after experiencing social isolation, worrying about their family and caregivers, among other challenges. Thankfully, we have a COVID-19 vaccine that has been rigorously studied in a clinical trial and has been found to be extremely safe for children 12 to 15. The Pfizer vaccine demonstrated 100% efficacy in preventing COVID-19 infection in children. Real-world use of this vaccine suggests that it's highly effective against the variants or the different versions of the virus that causes COVID-19. I would be remiss if I didn't discuss what parents or guardians can expect after or if they decide to vaccinate their children. Children experience similar post-vaccination symptoms compared to older people and adults. It's important to know that these symptoms are normal. They include things like fever, muscle pain, fatigue, pain at the site of the injection. They usually last only a few days. Importantly, one difference when you think about children getting vaccinated with COVID-19 vaccine is that if they have received any other vaccine, it's important that they wait at least 14 days before getting the vaccine. Lastly, and most importantly, as Dr. Scott and others have mentioned, it's important that everyone who is eligible, including children, get vaccinated to protect our children and each other so we can all stay healthy and safe. And with that, I will turn it back over to Dr. Alexander Scott.
Thank you, and I just want to finish up saying how honored I am to follow Dr. Sabina Holland, who's also a dear colleague and a wonderful superstar as well. So as we are finishing, thank you, Dr. Babineau, for hosting us here. This is where we started and where we will continue forward. I'm excited to even say that during this conversation, we started to hear about 12 to 15-year-olds heading to our major sites now. So we are going to start. Give us a few minutes to operationalize and get ready. By the middle of this week, we'll be ready to hit the ground running. But keep that energy going. We want to far surpass the 1 million that we're celebrating today. And with that, I want to say thank you.